Prioritizing practical care when treating prolonged grief disorder. Prioritizing practical care when treating prolonged grief disorder. That's what the copy and paste says. I think it should say prolonged, right? No, but it says prologued. All right, so I'm reading this correctly. And this is from the Psych Congress Network and from hmpgloballearningnetwork.com. And this is under the title of General Psychiatry. So prologued grief disorder is what is being discussed here in this article here. So, but before I get to that, Chris Cavallo, what's up, dude?
Oh, thanks for having me here, man. I'm just listening in. Do appreciate it.
I love you, man, dude. You doing all right?
Yeah, I'm all right. It's a little late. I'm glad to see you're up still doing stuff, though.
Yeah, man. I appreciate you.
Plug in.
All right. Okay, so here we go. This is, let's see. Since this is Psych Congress Network, I'm going to call this Psych Congress Network Reading. And enter this way. Here's the first piece of bread in my sandwich. You're listening to Psych Congress Network Reading, presented by Hakeem Ali-Bocas Alexander on the Wisdom app for World Reading Club in association with UniquilibriuM. HMP Global Learning Network, General Psychiatry, prioritizing practical care when treating prolonged grief disorder. Published on September 17th, 2022. Looks like the author is Alana Iglewicz, MD. I don't know if I'm pronouncing that correctly, but Iglewicz sounds pretty cool. It's actually spelled Iglewicz, but there's a Z in there, but I'm sticking with Iglewicz. It is just so cool. So this is Alana Iglewicz, MD. All right. Over 2 years after the onset of the COVID-19 pandemic in the United States, few lives remain untouched by the public health crisis that disrupted everyday life in countless ways, including established cultural rituals for final farewells to the dearly departed. It says departed. I'm going to screenshot this in case they update this so you guys don't think I'm going crazy. It says departed. Now, if that's a word that I haven't seen that means the identical thing, then I stand corrected. Psych Congress Network continues. On Saturday, September 17th, at the 35th Annual Psych Congress in New Orleans, Alana Iglewicz, MD, Clinical Professor of Psychiatry, University of California, San Diego, presented her session entitled, Good Grief. Prolonged, now here it's prolonged. Prolonged grief disorder in the context of COVID and beyond, before an audience of mental healthcare professionals, including doctors, nurse practitioners, care advocates, and nonprofit representatives. Okay, I see what's going on here. Today is still September 17th. It's almost midnight here in Virginia Beach, Virginia, on the East Coast, Eastern Daylight Time. And so whoever did this wanted to get out a quick article. I don't know if it was, if there was like a transcript that was made from the audio before, but so there are going to be some, it looks like, typos and things like that. So bear with me as I attempt to work them out. Here we go. Psych Congress Network continues. On Saturday, September 17th, at the 35th Annual Psych Congress in New Orleans, Alana Iglewicz, MD, Clinical Professor of Psychiatry, University of California, San Diego, presented her session entitled, Good Grief, Prolonged Grief Disorder in the Context of COVID and Beyond, before an audience of mental healthcare professionals, including doctors, nurse practitioners, care advocates, and nonprofit representatives. Ahead of her presentation, Dr. Iglewicz spoke with Psych Congress Network about how the pandemic affected diagnoses of prolonged grief disorder, heretofore known as PGD. I may interchange saying prolonged grief disorder and PGD, just so we are reminded of what it is we're talking about here. And hold as I go to the Wisdom app and change what the title should be, which is prolonged. I copied and pasted from here, but from Psych Congress Network, and I knew that it sounded somewhat strange, but went along with it because psychiatry is an interesting industry that has its own technical words, and I wasn't certain if it was some way of describing grief that I had not before encountered. And so it's prolonged. Psych Congress Network on the HMP Global Learning Network continues. Ahead of her presentation, Dr. Iglewicz spoke with Psych Congress Network about how the pandemic affected diagnoses of PGD, key symptoms clinicians should keep an eye out for, common misconceptions about the disorder, and where providers can find more resources for clinical practice. Psych Congress Network, PCN. How have the effects of the COVID-19 pandemic impacted the way in which clinicians diagnose and treat prolonged grief disorder, which is now formally recognized in the DSM-5-TR? Alana Iglewicz, MD. To say that the COVID-19 pandemic has been a time of loss is a gross understatement. Since the start of the pandemic, over 1 million Americans and more than 6.5 million people globally have died of COVID. At this point in the pandemic, nearly everyone knows someone who has died of COVID. Millions of people are more intimately grieving the death of a loved one Millions of people are more intimately grieving the death of a loved one to COVID-19. In essence, the world is collectively grieving. The pandemic has necessitated profound disruptions in death, dying, and mourning. With disruptions in families' abilities to say their final goodbyes, attend in-person funerals, and follow mourning rituals, many more people are at risk for developing and suffering from prolonged grief disorder, PGD. The COVID-19 pandemic has taught clinicians about the importance of incorporating themes of grief into our assessments, formulations, and support of patients. Our patients, our colleagues from other specialties, and the public are looking towards mental health professionals for our expertise on grief. My hope is that the pandemic has inspired mental health professionals to gain clinical sophistication with grief more broadly, and PGD, its assessment and treatment more specifically. Psych Congress Network. What are the key symptoms of PGD that clinicians should look out for in their patients? Dr. Iglewicz. PGD is a form of complicated and prolonged grief that is associated with considerable functional impairment, morbidity, and mortality. It occurs when people's normal adaptive grief experiences essentially get derailed. Key symptoms include pronounced yearning and longing, preoccupation with thoughts and or memories of the deceased loved one, disruption in identity, a marked sense of disbelief, considerable struggles integrating back into life after the death, feeling life is now meaningless because of the death, and avoidance of reminders of the death, all of which last 12 months or longer according to the DSM-5-TR, but notably 6 months or longer per the ICD-11. Okay, so just a note, the DSM-5, we only need to know DSM. It's the Diagnostic and Statistical Manual of Mental Disorders. So that's what DSM is. ICD, if I remember correctly, is the International Classification of Diseases. So these are just two things that are classifying and naming these disorders. Psych Congress Network on Global Learning Network continues. For most people who have PGD, the symptoms last endlessly without treatment. Many suffer for years to decades. This is pretty startling revelations, but not unfamiliar to me. And this is one of the reasons why it stuck out, and one of the reasons why it's being shared, because it's very impactful, and it has a lot of significance. Psych Congress Network continues. From a clinical perspective, it is helpful to pay attention to the qualitative feel of the grief. People who have PGD are not just stuck in their grief, they are frozen in the acute stages of grief. In PGD, grief can be all-consuming. Individuals suffering from PGD often feel as though grief is all they have left, and that to stop grieving so intensely would be a betrayal to their deceased loved ones. Subsequently, there is not breathing room left for life to enter back in. When evaluating a patient who experienced the death of a loved one, their pain feels so raw, so near to the surface that you naturally assume their loved one must have died in the past 2 months. Then you learn that the death occurred years ago, possibly decades ago. That disconnect is key and should be salient. It strongly hints that you should further evaluate for prolonged grief disorder, PGD, and refer for life-affirming and, at times, life-saving treatment if PGD is present. Psych Congress Network. In your session, you mentioned that there was controversy over PGD being included in the DSM-5-TR. Are there any misconceptions on this topic that you would like to clear up? Dr. Iglewicz. One of the most heavily debated changes to the DSM-5 and now the DSM-5-TR centers around grief. With the DSM-5, the debate was more specifically related to the removal of the bereavement exclusion. With the DSM-5-TR, the debate relates to the addition of prolonged grief disorder as a formal diagnosis. Those opposed to these changes, hold on, pause. All right. Psych Congress Network continues. The debate relates to the addition of prolonged grief disorder as a formal diagnosis. Those opposed to these changes fear the medicalizing and pathologizing of a natural human process, grief. Proponents of these changes fear the lack of recognition of, and thus lack of treatment for a condition that leads to profound suffering and that has a robust evidence base for efficacious treatment. Okay. This is notable for me to use this as a section to quote, because that's exactly it going in here. Those opposed to these changes fear the medicalizing and pathologizing of a natural human process, grief. Proponents of these changes fear the lack of recognition of, and thus lack of treatment for a condition that leads to profound suffering and has a robust evidence base for efficacious treatment. Psych Congress Network continues. In many senses, those in opposition to and those in favor of the changes to the DSM-5 and DSM-5-TR are having different debates. Those opposed to the changes are having a philosophical debate. Proponents of these changes are having a practical debate. From a philosophical standpoint, concerns about medicalizing and pathologizing the human condition apply to the near entirety of psychiatric diagnoses. Nearly every human has experienced anxiety. At some point, we draw a line, and past that threshold, we call it an anxiety disorder. All humans experience sadness. At some point, we draw a line, and past that threshold, we call it a depressive disorder. Grief is an easy target for such a debate. In my experience, those who are most opposed to the addition of PGD in the DSM-5-TR are not trained in its most evidence-based treatment, prolonged grief disorder therapy, and have not had the privilege of helping to utterly transform people's lives with this powerful mode of treatment. The debate around prolonged grief disorder is an important debate, and is also one that should not be singularly applied to grief. Continued dialogue and critical thought is needed. At the same time, the more of us who are trained in the evaluation and treatment of PGD, the more we can alleviate pronounced suffering. In light of the myriad losses associated with the COVID-19 pandemic, this is more important now than ever in our lifetimes. Psych Congress Network. Where can clinicians go to get resources and further education on the disorder and its treatments? Dr. Iglewicz. Key articles delineating how to best conceptualize, evaluate, and treat PGD exist in the medical literature. Notably, PGD was formerly called complicated grief, and prolonged grief disorder therapy was recently and formally called complicated grief therapy in the literature. Although some nuances exist between the different terminology, other terms used interchangeably with PGD include traumatic grief and pathological grief. One of the best resources for learning more about PGD and its treatment is the Center for Prolonged Grief, formerly called the Center for Complicated Grief. The center's website, https://prolongedgrief.columbia.edu, hosts a wealth of information about PGD and PGDT, both for the public and for professionals. Psych Congress Network. Are there any other takeaways you would like to discuss? Dr. Iglewicz. Recognizing and treating people who suffer from prolonged grief disorder can be one of the most meaningful parts of your career. Doing so affords you the privilege of helping people re-engage in life with a renewed sense of meaning, purpose, and connection, not just with the living, but also with loved ones who are no longer alive. Alana Iglewicz, MD, is a clinical professor of psychiatry at the University of California, San Diego, as well as the Associate Residency Training Director for the Department of Psychiatry and the Director of Wellness Initiatives at the UCSD School of Medicine. Dr. Iglewicz earned her BA in psychology at the New College of Florida and her MD at the University of Pittsburgh School of Medicine. She then completed her residency training in general adult psychiatry and subspecialty clinical and research fellowship training in geriatric psychiatry at UCSD. Her clinical work is focused at the La Jolla VA, where she works with trainees in the psychiatric emergency clinic and is the psychiatry medical director of the mental health primary care clinic. She is passionate about healthcare, professional wellness, and is the faculty chair for both the UCSD Psychiatry Residency Wellness Committee, as well as the SAVE Committee, which is dedicated to providing support to psychiatry residents after the occurrence of adverse events, such as patient suicide and patient violence toward trainees. Her research focuses on physician wellness, psychiatric education, late and end-of-life depression, and bereavement. Throughout her career, Dr. Iglewicz has received numerous teaching and clinical awards. You've been listening to Psych Congress Network Reading on the Global Learning Network, presented by Hakeem Ali-Bocas Alexander on the Wisdom app for World Reading Club in association with UniquilibriuM. Prioritizing practical care when treating prolonged grief disorder. Okay, so that was an enlightening interview. And it seems that very often I'm able to have some research and reporting like that land in my email box or see it as a book on a bookshelf somewhere or something like that. And so this was no different of something that was very necessary for me to encounter and to learn more about and to share. And it has a lot of implications. She was very astute in pointing out one of the debate surrounding it, because that was actually the first thing that I thought when I looked at the article. But I read these things anyway, regardless of my bias. And I was not surprised that Dr. Alana Iglewicz, MD, put this into her interview or spoke about it. But I don't exactly know exactly how I feel. I was satisfied that it was addressed, and what I'm talking about is the debate that there's debate relating to the addition of prolonged grief disorder as a formal diagnosis in the DSM-5-TR. And so, quoting from the article once again, it says, those opposed to these changes fear the medicalizing and pathologizing of a natural human process, grief. That was my first concern. I always have my suspicions about the entire industry of psychiatry overall, even though it's probably unfounded. But I temper those things by reading through research, news, and interviews like this. Instead of looking at all of instead of looking at material that's opposed to almost everything, you can find conspiracy theories everywhere. And I'm definitely informed by a lot of different things. So it was rather refreshing, is another word that comes to mind, to see such a balanced inclusion. And so in order to continue the balance, she continues by saying, proponents of these changes fear the lack of recognition of, and thus lack of treatment for a condition that leads to profound suffering and that has robust evidence base for efficacious treatment. There's more that is said in here that is really, in my opinion, extremely important for people to be educated on and to be aware of. And she's saying that there's efficacious treatment. Nowhere really in here did she say anything about using medication. They just said efficacious treatment. That may be a way to kind of sidestep that their efficacious treatment does include medications. I mean, for goodness sakes, she is a psychiatrist. That's what they train for. But what is interesting is that what Dr. Alana Iglewicz is saying is that there are efficacious treatment for that, meaning that people are, or what I would like to assume, getting back to life that's functional in a healthy way, and living with the grief rather than attempting to avoid it or self-medicate or self-treat in some unhealthy way. So it's talking about prolonged grief disorder, which she addresses with prolonged grief disorder therapy. It went through some different changes, but one last thing I'd like to say about this before I shut down the room or talk to Chris a little bit more is I'm really further impressed by the following statements on that in the next paragraph. So Dr. Alana Iglewicz says, in many senses, those in opposition to and those in favor of the changes to the DSM-5 and DSM-5-TR are having different debates. Those opposed to the changes are having a philosophical debate. I have to agree with that as a person who not necessarily was opposed to the inclusion, because I didn't even know about it before reading this article. But when I saw the title, I immediately thought, this is a way to pathologize and therefore medicalize grief. But this is a very insightful, refreshing stance on it that this psychiatrist, Dr. Iglewicz, has. She continues, those opposed to the changes are having a philosophical debate. Proponents of these changes are having a practical debate. From a philosophical standpoint, concerns about medicalizing and pathologizing the human condition apply to the near entirety of diagnoses. Nearly every human has experienced anxiety. At some point, we draw a line, and past that threshold, we call it an anxiety disorder. All humans experience sadness. At some point, we draw a line past that threshold. We call it a depressive disorder. Grief is an easy target for such a debate. In my experience, those who are most opposed to the addition of PGD in the DSM-5-TR are not trained in its most evidence-based treatment, prolonged grief disorder therapy, and have not had the privilege of helping to utterly transform people's lives with this powerful mode of treatment. So I'm going to focus on that. as I look into this more. Her words are very, very moving. She seems actually human to me. I never realized before that I had dehumanized a lot of psychiatrists. And I pick and choose who I do that to because of my experiences, which have been negatively biased. So for some reason, there's a few psychiatrists on here who I haven't had that negative bias towards. Maybe it's because they're on this platform. Oh gosh, excuse me. Anyway, there we go. It's already been 30 minutes since you popped on here. How you doing, man?